I'm Dr. Cecil Bennett. I have been a primary care physician for over 20 years. During that time, medicine has evolved. For millennia, medicine only dealt with physiological or physical issues that involve organ systems like the heart attack, the brain, stroke, or the lungs, cancer, etc. In the last 30 years or so, medicine became more serious in recognizing the importance of mental health issues, such as depression, anxiety, PTSD, bipolar disorder, schizophrenia, etc. Most of us are old enough to remember if someone were depressed, they were told to snap out of it. Snapping out of clinical depression is as viable as snapping out of a broken leg. It's not going to happen. A more recent field of medicine, a field I have termed physical appearance health, is now showing to play a major role in overall health. Physical appearance health describes two things: what one thinks about one's physical appearance and what one believes others think about one's physical appearance. This belief system can be considered to be acceptable or unacceptable. It would be considered perfectly fine if someone were in a car accident and needed facial reconstruction surgery. That would be considered acceptable. It would be considered acceptable if someone were burnt and needed burn grafts. Again, for their physical appearance, this would be acceptable. But what about someone like this who believes that their nose is gigantic or grotesque? Or someone like this who believes that they're grossly overweight and spends most of their time looking in the mirror or avoiding people because they believe, again, that they're overweight? This would be considered unacceptable. But what about most of us somewhere in the middle? Those who are losing our hair, those with severe acne or other facial blemishes, those who can pinch more than an inch, those who have cellulite that they love to get rid of, maybe those who can't see their toes. What is considered acceptable or unacceptable for these individuals? Over these 20 years in medicine, I have noticed when patients make reasonable aesthetic changes in their appearance, it has worked wonders for their overall health. After hair restoration, body contouring, aesthetic facial treatments, and other procedures, they seem to be more motivated, confident, and positive about what they can achieve. They are more compliant with their medications, they're eating better, and going to the gym more. They're less depressed, anxious, and just are in a good place mentally. It is for this reason I created New Body and Face Aesthetics. As a physician, via New Body, I'm now able to satisfy my patients' physiological or physical needs, their psychological or mental health needs, and now their physical appearance needs. Seeing a client's reaction to our private med spa on the 24th floor of an Atlanta high-rise when they first walk in, and their happiness after their treatment, makes me feel I am now meeting all the needs of my patients.